Uno, dos, tres. All right. A couple of you wrote a message saying that you guys have some kind of a physical barrier that you cannot go over to exercise. And this is one of the other concerns with the weight loss. I want to make it absolutely clear to all of you: you do not lose weight with exercise. Exercise will accelerate it. However, the weight loss is done with caloric restriction, meaning you eat less than what you expend. It is extremely difficult for me or any other person to prescribe you an exercise regimen when you have other physical barriers, such as you can't move your right foot or your left shoulder doesn't really function well. It's unbelievably difficult. It is almost impossible without me being down there going through battery of testing to see what can be done, and gone through a doctor to see if what kind of a exercise regimen will be most beneficial, because you guys have to remember skeletal system function in a certain way. Yeah, the muscle will work as long as it gets the input, and as long as it got some ATP in it. You supply some calcium, it will contract. However, that doesn't mean it will give you the best outcome, the best way to get you healthier. Just because you're trying to exercise doesn't mean you should cause a damage to the other areas. So, let me give you an example. For the people who has lower back or knee issues, for cardiovascular exercises, what we prescribe is a bicycle. Basically, it's a hand bike. You just keep going at it. Okay, you increase the intensity of it, resistance of it. So you just keep going. It's an upper body exercise, but at the end, it will get your heart rate higher. Okay, so it is very difficult, almost impossible for me to sit there and tell you without literally sugarcoating anything that this will get you better. I'm sorry, I can't do that. There's no magic answer for that. However, if your concern is weight loss, that is something easy. I am going to start making couple of videos about weight management, because it's really not about just weight loss. If you look at Oprah, poor woman has suffered decades. Her weight went up and down because she has money and everybody wants money. So everybody give her a fish rather than how to teach her how to fish. So what I'm going to do to you guys, I'm hoping that I will teach you how to fish. So once you lose the weight that you want, once you get to the weight that you desire, the maintenance starts, and maintenance will be lifelong. My weight hasn't changed. I've been between 195 and 200 for the last 7 years, I believe. Before that, it was 185. So I maintain it quite well. I did gain some muscle mass. Of course, I get in and out of the challenges. Most of the time, what I lose is the water weight. And you have to keep in check at all times. That's something you have to live by, going back and forth. What I normally suggest, I call that a control. You get a pair of jeans, you put them on, it fits. After you have completed the weight loss phase of the weight management, you put them on, okay, put them away. You do not use that pair of jeans. It costs freaking $10 in Walmart. You can get one, and then once a week or once every 10 days, you take it out and put it on. It's getting snug a little bit. We're gonna do a little bit of a tricking on the caloric intake to see if we can go back to normal. That's control. It keeps you in line as far as weight gain or not. That's how I suggest to most people. Now, if you drink, okay, you will retain water. If you eat salt, you will retain water. When you go into a menstrual cycle, you will retain water. So you have to pay attention to those things. I don't eat salt at all because I am so sensitive. When I go out to eat like a Chinese buffet, I call it Chinese because it came from China, not because I'm racist. Okay. I will my weight go up about 8 pounds because of all the water retention, because it is salty food. Because salt, it what gives the food its flavor. I swear to God to you, I go to McDonald's and ask for fries with no salt. Jesus, they taste like cardboard. Cardboard. And I'm looking at it like, this is the one that tastes so good with salt. It is. Salt gives everything its flavor. So salt is number one. Your menstrual cycle, you just have to pay attention not to do your control check in your menstrual cycle, because women will gain some water weight throughout the cycle, which is normal. It comes and it goes. The last thing is alcohol. Every time you drink, you'll swell up the next couple of days. I don't drink. I don't have those problems. Not anymore anyways. If you stop drinking, it's all even better, because at the end, it's a toxin that the liver trying to get rid of. Why put a toxin in your body? We'll discuss this some other time. So if you have a body part that's not functioning like it should, like normal, like I shouldn't say normal, but I should say it doesn't function like most of the other people, you can always do some research. If it is left shoulder that's bothering you, that's preventing you from doing certain activities, sit down. YouTube is wonderful. You sit down, you can type something like physical therapy after shoulder injury, or exercises with shoulder injury. It will pop up a whole bunch of stuff. Like I always say, mode of exercise is irrelevant. As long as whatever you're doing keeps your heart rate up, that's all that matters, really. The only other thing I would caution you, everything is kinetic, right? In the 80s, they start finding CEOs in their desks dead. Literally, dudes just die in their offices, and they came to figure out isometric contraction, meaning the muscle does not change its length, but it creates force. So you grab this and just pull and pull and pull. Yes, muscle is functioning. You are burning calories. You are getting the muscle stronger only at that angle. What they find out that the people who do isometric exercises tend to hold their breath. That's number one. You always breathe through every exercise. You don't increase your thoracic pressure, because what it does, it rips something, causes a hernia. And from down there up here, it doesn't matter. You don't want to rip anywhere. So isometric exercises, try to stay away from them. What the CEOs were doing, sitting on the table and trying to lift the table. Now the biceps are contracting, the shoulders, the pecs are engaging. There's no movement, there's muscle engaging, and they're holding their breath. And because they didn't, you don't get to be CEO at 25 unless your name is Zuckerberg, and mine ain't. So you don't get to that level of success, I don't want to say, at a younger age. So they're always older gentlemen or older ladies who are at that level. So they just have a heart attack and die in there. So be careful with the isometric exercises. Other than that, do some research. Always never take my word or anybody's word. Do some research on your own. You trying to get better, you're going to help you. Yes, you're going to take my advice, somebody else's advice, you're going to collectively, but you're going to have to do some exercise for your unique needs, and that's going to give you the optimum results. Again, we will start with the weight management soon. Since then, you guys stay healthy, stay happy, and most importantly, always smile.